Testing. Hello? Are we on? Yeah, we're good? Okay. Healthcare. Everybody needs it. Nobody understands it. SF Weekly is here to help you wade through three competing healthcare bills that are currently wending their way through the California legislature.
Governor Schwarzenegger's plan, Senator Kuhl's bill, there's the proposal that the Speaker of the Assembly, Mr. Nunez, is working on, and they all reach a variety of levels.
We consulted SF Weekly consulting expert. I forget his name, but he knows a great deal about healthcare. Our consulting expert shared with us that insurance companies aren't doing what their customers think they ought to be doing.
Everyone agrees that something has to be done to fix this problem.
Governor Arnold Schwarzenegger has a healthcare plan.
Governor Schwarzenegger's plan essentially means taking money from the taxpayers and putting it into the pockets of private insurance and letting them essentially run the system. His plan is similar in part to the Massachusetts plan, which, if I could boil it down into its simplest terms, takes the same approach as car insurance. It requires that everybody who has a car has to have insurance. So this would be every citizen of the state has to have health insurance. And you're going to have to pay for that health insurance. If you can't pay for it, there will be ways to help you pay for it. And some of those ways require you possibly going into a debt that you didn't really need or couldn't take on.
There are two other pieces of legislation. Let's let our consulting expert explain.
Speaker Nunez's plan is a much more liberal plan but still allows for the participation of the private profit-making companies. He is on the record as being for single-payer and for removing profit from the system. He believes that cannot and will not happen with a Republican governor, and that Schwarzenegger will just continue to veto anything that's further to the left of his proposal. Senator Kuhl's bill probably comes closest to what I believe needs to happen, and that involves trying to remove as much as possible the profit incentive out of healthcare and have a single-payer system. Probably not that much different from the bill that the governor vetoed. Those are essentially the three plans, and I guess obviously Senator Kuhl's is closer to what I believe. Speaker Nunez's is probably a more pragmatic solution, considering you have a Republican governor in the state, and if you want to get something passed.
Sounds like he believes that the Schwarzenegger bill is perhaps the weakest, the least favorable to patients, the most favorable to insurance companies, and two other bills sponsored by Democratic legislators would be further toward the goal of really serving patients and not giving power to decide who gets saved and who dies. Not handing that power to the insurance companies.